Which of the following ECG finding indicates hypokalemia? The answer is ST segment depression. ST segment depression. The earliest electrocardiogram change associated with hypokalemia is a decrease in the T wave amplitude. As potassium level decline further, ST segment depression and T wave inversions are seen. The earliest electrocardiogram change associated with hypokalemia is a decrease in the T wave amplitude. As potassium level decline further, ST segment depression and T wave inversion are seen. T wave inversion on the ECG are seen in following condition except T wave inversion on the ECG are seen in following conditions except. The answer is hyperkalemia. Hyperkalemia. Tall T wave, that is more than 5 mV in standard leads and 10 mV in chest leads, is seen in hyperkalemia. All the other condition causes T wave inversions. Normal peer interval in ECG is. Normal peer interval in ECG is. The answer is 0.12 to 0.20 second. Normal peer interval in ECG is 0.12 to 0.20 second. Next, hyperkalemia leads to what changes in ECG? Hyperkalemia leads to what changes in ECG? The answer is tall T waves. Tall T waves. QRS complex in ECG represent. QRS complex in ECG represents ventricular depolarization. Ventricular depolarization. QRS complex in ECG represent ventricular depolarization. ST segment. ST depression in ECG represent. ST depression in ECG represent. ST depression in ECG represent myocardial ischemia. Myocardial ischemia. Which of the following ECG finding indicates myocardial infarction? Which of the following ECG finding indicates myocardial infarction? ST segment elevation. ST segment elevation. Which of the following ECG finding indicates myocardial infarction? The answer is ST segment elevation. The most important cause of ST segment abnormality, that is elevation or depression, is myocardial ischemia or infarction. Both ST segment elevation and depression are seen in MI. STEMI, ST elevation myocardial infarction, STDMI, ST depression myocardial infarction. Hypokalemia causes U wave presence. Hypokalemia causes U wave presence. The client is suspected to have cardiac tamponade. Which of the following findings in QRS complex of a lead to ECG will support the suspicion? The answer is amplitude decrease. Amplitude decrease. Peaked P wave, decrease of QRS complex voltage, left axis deviation of the QRS complex, deep T wave inversions and ST segment change are present in cardiac tamponade. Fluid accumulated in the pericardium suppress the amplitude of the QRS complex on the ECG.